do? What do you do? What do you do?
One or three. Yeah, that is footage from Ego, local government in Edo State, and it's a case or cases of suspected vote buying. You know, earlier when we heard that EFCC was also going to be on ground during these elections, some people wondered, EFCC, nobody is going to try to buy votes openly at a polling booth. Well, I'd like to tell you guys that you were actually wrong. Somebody was actually, taken away for trying to give incentives for votes. So you see that EFCC being there actually served a purpose. Ego, local government in Edo State, going on. A correspondent just sent us this clip of suspected vote buying. Right. So, back to the studio now. Yellow fever is a serious viral disease transmitted by infected mosquitoes, posing a significant public health threat in Nigeria. Measles is a vaccine-preventable childhood killer disease. Children who are not vaccinated against measles through routine immunization at 9 months are vulnerable to measles complications during measles outbreaks. And then cervical cancer is the second leading cause of death among women. These are the reasons why the Lagos State Ministry of Health, through Lagos State Primary Healthcare Board, is in collaboration with the National Primary Healthcare Development Agency, the World Health Organization, and other key stakeholders, is launching a mass integrated vaccination campaign for yellow fever, measles, and human papillomavirus aimed at preventing outbreaks and protecting citizens. To talk to us more about this, I'd like to welcome the Vice Chairman, Medical Guild, Medical Officer of Health, Ifelodun Local Government Development Area, Dr. Japhet Olubugi.
Thank you for having me on this show this morning.
Thank you for coming. And I see that you were making a comment when that footage was going on about people trying to buy votes.
Yeah, you're right.
Now, tell us, we were of the impression that measles, for instance, was something that you didn't have to convince people to go vaccinate their children against. Why this massive campaign? We thought people were all aware that as X number of months, you must take your child for this. At X number of months later, you must also take that child. And we thought that enough campaign had been carried out about those milestone vaccinations?
Yes, thank you very much for having me on the show once again. Like you mentioned, one would have thought that measles or yellow fever or HPV vaccines, for that matter, are vaccines that people ordinarily would readily take. But of course, we have children who are missed out of this vaccination exercise that we carry out. Nigeria has a routine immunization schedule for children, and measles is one of them. The measles vaccine is one of them. And at 9 months, one would expect that a child would take the measles vaccine and the yellow fever vaccine. But what happens is that we have a lot of children who miss these vaccinations for circumstances sake, because of vaccine hesitancy, cultural beliefs, maybe because they are in hard-to-reach areas, maybe because they are out of areas where they ought to get the vaccine when the vaccination exercise is going. Also, because of mistrust in government. So we have a lot of missed children, not only in Lagos State, but all over the country. And then Nigeria carried out a mass campaign on measles in 2022. But then again, in Lagos, we had a coverage of 63%. That means that there are so many children, so many babies who ought to have been vaccinated, who were not vaccinated. Not because we didn't want to vaccinate them, for exigency's sake, and all those other factors that I mentioned earlier on. So there are so many missed children. Now, these missed children from 2022 up until now, we have also had a number of outbreaks of measles in the community, not only in Lagos, all over Nigeria. We're just last week, we reported 4 measles cases, suspected measles cases in Ajegunle area of Lagos. And of course, if you start calculating the number of measles cases that we have picked up in the last 1 year all over Nigeria, it's a lot. So there are so many children who ought to have been vaccinated for this disease, who missed the opportunity to get the disease, to get the vaccine. Also, for yellow fever, yellow fever is endemic in Nigeria, being a tropical country. Also, South America is also, in that region where yellow fever is endemic. But for Nigeria, the problem is that we have a lot of mosquitoes. The species that spread the yellow fever virus, it's very common in Nigeria. So we have a lot of people coming down with yellow fever, especially in the northern part of the country. But of course, the NPHCDA and the federal government has responded by carrying out a vaccination campaign against yellow fever all over the country, except Lagos and one other state. I'm not quite sure, I think Borno. So we have had the vaccination campaign in many parts of the country, but Lagos is yet to have it. Now, if you combine those two analogy together, you would have a number of people in the community who are supposed to be vaccinated against these killer diseases, but who are walking around. So the risk is high. And that is the reason why this campaign is coming up. Okay. And it's an integrated campaign where our children who missed the opportunity to get vaccinated for measles and yellow fever would have a fresh opportunity to be vaccinated against these diseases. Also, adults who have not been vaccinated against yellow fever will also have the opportunity to get the vaccine. Those who were not able to get vaccinated against the HPV vaccine will have the opportunity to be vaccinated against the human papilloma virus disease.
Okay, let's talk about measles for a bit. It's like we don't understand the importance of that vaccine. First of all, at what milestones should a child take the measles vaccine?
The Nigerian immunization schedule states that a child should take the first dose of the measles vaccines at 9 months.
9 months.
And there's a follow-up dose, which we call booster dose, at 15 months.
15.
And so that is what we have on the schedule. But what we have is that a lot of mothers bring their babies they get the first dose, they don't get this booster dose. A lot of mothers don't even bring their babies to take the first dose at all. You see, on our immunization schedule, we start at 0 age, at the first day of life, where they take the BCG, hepatitis B, and what have you. And most of those vaccinations terminate at 6 months, but it does not terminate at 6 months. So most of them erroneously think that once they've collected the vaccines at 6 months, they're done. But they're not done, because at 9 months, they ought to take the measles and the yellow fever vaccine.
Okay.
But we have a lot of babies missing out on this.
What is the implication of not taking the booster?
Fantastic. Now, first of all, let's even talk about the implication of not taking the measles vaccine. The measles is one of the 6 childhood killer diseases, especially in Nigeria. And we have a lot of children coming down with it. There's no cure for it. Even yellow fever, there's no cure for it. But there is a vaccine for it. So when a child takes the vaccine, they are protected. Now, when they take the booster dose, they are protected for life. So that is the essence of taking the vaccine. There is no cure for this disease. When a child comes down with the disease, what we do is give them supportive treatment until their immunity is able to combat the disease and they get out of the disease. But the vaccine protects the child.
So when a child contracts measles, there's no cure?
There's no cure. And it's a highly transmissible disease.
So what happens to that child?
The child comes down with the symptoms of measles.
Has those rashes.
Yeah, those rashes, very nasty
and then
rashes.
Recovers.
Very nasty fever, yes, and then recovers.
Miraculously.
Well, of course, what happens is that when you have a disease, the body recognizes that there's a problem and start fighting it. Okay. Now, those who have a strong immunity will be able to fight it. Those who do not have may not be able to be so lucky. And of course, sometimes malnutrition, other diseases like HIV, some drugs can lower the immunity. And nowadays, when we have, some challenges in the country, a lot of people are not feeding well. A lot of babies are not feeding well. A lot of children are not feeding well. So they need the support of these vaccines to be able to boost their immunity.
Before I let Ayo ask his question, we have heard that children who come down with measles also have other things that follow, even when they have recovered, like deafness. I've heard about deafness.
Yeah, it's one of the complications of me coming down with measles. Blindness also. A child can go blind after coming down with measles. So many other things can follow. But of course, who wants to see their child suffer? You need to see a child who has measles. It's a lot of suffering. The fever is so high, and the nasty rashes that you mentioned, not to talk of the runny nose and the cough and all that. So what we give is antibiotics, analgesics, a lot of fluid to support the child, to make the child comfortable. But of course, it's a lot of stress on the mother, a lot of stress on the hospital, a lot of stress for the child, a lot of stress on the economy of the family.
Okay. Ayo.
Dr. Lubogi, I know that one of the things that you would want to achieve is herd immunity, but before we get there, can you just tell us what mechanisms are in place for accessibility? Because vaccination sites would make it more accessible to the citizens, particularly in hard-to-reach areas of Lagos.
Yeah, thank you very much for that question. It's a very wonderful question. The program is planned in such a way that we have what we call the fixed posts, which are the health facilities. We're talking about the primary healthcare facilities, the secondary, and the private hospitals. Apart from that, there's what we call the temporary fixed posts, which may be in form of a church, which may be in form of a school or a community leader's compound, like a ballet or traditional leader compound. So that is the temporary fixed post. And then we also have teams who are going to go house to house, schools, to churches, to market, to all those public places where they can find all the children that they can find. So these are the strategies in place. And anybody who also prefers to walk into a private hospital, our teams are going to be there. Anybody who prefers to walk into a hospital, a health facility, our teams are also going to be there. So these will help everyone have access to this vaccination. Also, plans are in motion to send teams across water to different places where they are hard to reach, to difficult terrains. There are plans in motion to send teams to these places.
How about misinformation and vaccine hesitancy? Because, I mean, of course, you know that, those are crucial issues, especially coming at a time when the people are concerned about their safety and even the efficacy of the vaccines.
Let me start from the efficacy of the vaccine. The vaccine we are rolling out, and any vaccine that comes from the government of Nigeria, is efficacious because there are solid plans for storage, for administration. These vaccines are stored safely in cold chain equipment which are powered by solar. It's not reliable on the normal mainstream power, but on solar. So these equipments run 24/7 without fail, and they're being monitored every day. There are tallies, there are items that are being monitored, that are being used to monitor the safety of these vaccines and the storage capacity. So the misinformation, one of the things we're trying to achieve right now, as we speak, is to roll out information, credible information, reliable information to the citizenry so that they can have first-hand information from commissioned officers from maybe the NPHCDA, from the WHO, from the Lagos State Primary Care Board, or even from the medical associations themselves. So there is a body, a committee of officers dedicated to giving out information, just like we have different pillars of other officers concerned with logistics, concerned with transportation, concerned with distribution of vaccines, for administration of vaccines. So we also have a pillar as is in charge of information dissemination, risk mobilization, and risk communication. So the misinformation, we don't envisage that it will be a problem. Also, people also have hesitancy, and that's one of the reasons why we are on air. We are going to be doing a lot of advocacy with all the stakeholders, including community leaders, traditional leaders. This is already ongoing. We're also sending letters to schools, to hospitals, to private facilities, to churches, to mosques. We are meeting all these important stakeholders in the community so that we can reach out to the community members and dissuade their fears on this vaccination campaign and subsequent exercises that we may carry out in the country. So vaccine hesitancy, we are aware, and we are doing a lot to dissuade and convince people otherwise.
Well, interestingly, Dr. Olubogi, I mean, you may want to also quickly confirm this, that we experienced a mass measles vaccination campaign in 2022. Is that correct?
Yeah, that's correct.
Okay. Now, having done it then, one would be wondering why there is now a new cohort of unvaccinated children. I mean, just as you said, we're just about 2 years ago. And what strategies do we have to ensure these children are reached during this campaign?
Okay, so first of all, I think the most important thing is adequate information dissemination, creation of awareness, sensitization, which we have begun now. There's going to be a lot of airing of this kind of session that we are having now, not only by us, also by the associations, the APHPN, Association of Public Health Physicians, Medical Guild, NMA, M1, all of them are going to be involved, and we're going to be going on air a lot, whether radio or TV, using the traditional media, social media to, convey information to members of the community. Now, what happened in 2022 is that we missed a lot of children inadvertently because the coverage for Lagos State then was 63%. And of course, the target was 90 to 95. And if we had a target of 90 to 95, and at the end of the day, we recorded 63%, you will agree with me that we have missed a lot of children, at least 37% downwards of children that we have missed. So the idea is that these children that were missed in 2022 will have a fresh opportunity to get a catch-up vaccination in this exercise.
Well, this leads me to the question of herd immunity. So help us understand how the idea of herd immunity works in the context of yellow fever and measles in particular.
So the idea of herd immunity is such that if you have 10 people in a room and there's an outbreak of disease, if you can get to vaccinate about 8 of them or 9 of them, what will happen is that there will be nobody to spread the disease to the last set of people. Let's say you vaccinated 8 people now in the room of 10, and what will happen is that those 8 people will not be able to spread the disease to the remaining 2 people. That is simply what we mean by herd immunity. So we are trying to vaccinate a sizable number of community members. For measles and yellow fever, we're talking about 85 to 90% coverage. So when we can vaccinate such high number of children, what will happen is that you would hardly have any child that can spread the infection to another set of children.
All right, now let me quickly ask you about HPV, because we don't seem to have talked much about that in this conversation. This HPV vaccination, we know, it's also public knowledge that cervical cancer is about the second leading cause of death among women. So how does Lagos, particularly maybe the Ministry of Health, plan to overcome the barriers related to HPV vaccine uptake?
Now, that's a very valid question because the last time we had the HPV vaccination, there was a lot of hesitancy, a lot of barriers that came up to the HPV vaccination. And a lot of people have come out, research experts, biologists, so many interests to talk about the HPV vaccination. And what we realized is that we need to create more awareness. We need to talk more about it. We need to be able to convince people so that they would see the need for the vaccination. One of the important takeaway points from that campaign was the fact that a lot of people felt that, okay, you are vaccinating children between 9 and 14 against human papilloma virus, and you are saying that you do not expect, you are trying to protect them from, because you think that these children are those who are in the age group of those who are already having sexual intercourse, that it will promote children, that it does not happen because you are trying to catch them young. You're trying to catch them before they start having exposure. Yes, before they start having the exposure. So we know that once we can give them the vaccine at that age, we are protecting them against the HPV.
You say in your message that yellow fever is preventable. How is that? It's
preventable by giving the vaccine. Yellow fever is being spread by mosquitoes. And then if you take Lagos, for example, which is yet to carry out the mass vaccination campaign against yellow fever. If somebody from the north comes to Lagos who is already infected and the mosquito bites the person, the mosquito can spread the infection to other people in Lagos. And we have a problem on our hands.
All these vaccinations are, of course, free.
Free, of course, free.
And you have told us earlier that they are safe.
They are safe. and they are available.
Okay, so all those who are suspicious of vaccinations, these vaccinations are safe and they are free and they will save lives.
Absolutely.
It's not that they might, they will
absolutely
save lives. So Lagos State is saying, go there, take your vaccine, whether it is for measles, for yellow fever, or for
HPV.
HPV.
There's also the oral polio vaccination.
Oral polio. So vaccinations going on. And the campaign is on. Dr. Japheth Oluboyi, Vice Chairman, Medical Guild, and Medical Officer of Health, Ifelodun, LCDA. Thank you very much for coming to enlighten us this morning. We wish you all the best in your campaign. And you say the last time you achieved a 63% rate of success. We hope that you will achieve.
We are hoping to achieve 95% this time.
We hope that you will achieve 90 this time.
With the support of everyone, community members, community leaders, the local government, everyone, the medical associations,
Thank you very much.
The imams, the pastors, we will achieve it.
Thank you very much.
Thank you very much for having me. We're going to come back if you will permit us.
We're always here for you.
All right. All right. Thank you so much.
Thank you. So Sunrise will return in just a moment with another interesting conversation. Do stay with us.